Thank you, Sam Chiari, for taking over. But I'm back, and a Queensland MP has taken aim at the state's healthcare system, calling for one of the hospital's ICUs to be upgraded as cases of coronavirus rise. Federal Liberal MP for Bowman, Andrew Laming, has also expressed his concerns over the virus and contact sport, calling for tougher measures amid the outbreak. For more insight, Andrew joins me now. Andrew, thanks for joining us tonight on Sky News across Australia. OK, so there's a big debate going on right now about sport, particularly the NRL and the AFL and what they're going to do in coming days and weeks and months. But you're concerned also about junior sport, aren't you?
Look, of course, Peter, but before we get into sport, really, these events from yesterday have been overrun by today. Look, I first want to say two very important pieces of research have been released overnight. A summation of Wuhan case management showing that the mortality rate from this disease for those under the age of 64 is sitting at around about 0.5%, not the 3 that we've been hearing. That's about 5 times higher than the flu, of course. But those figures relate to patients who, in 7 out of 8 cases, were never diagnosed nor appropriately managed for their corona infection. I believe that Western health systems will do way better than that. So let's just refocus here. Less than 0.5% mortality rate out of Wuhan. We have the chance to catch up and do it far better. This is not the death sentence that was portrayed out of China. I think everyone needs to take a breather here. We will get through it. China's already reduced the new cases to under 100 a day. So we need to have that same curve and we will get over it. No one's going to run out of food. We've been running through Woolies and Coles and clearing out the shelves of loo roll, and I know that that was funny to watch.
Ludicrous.
We all made memes about it, but nothing's happened for 4 weeks, and it's about time that the supermarkets spoke to government, came up with a solution, because everything, as of yesterday, has stopped. We're not getting food to childcare centres, aged care facilities, the homeless, all of these have been held up. They've suspended internet shopping, and we should have been planning for this weeks ago. I'm quite upset with supermarkets. They've been somewhat paralysed by their need to put the customer first. They probably enjoyed the throughput and the shopping, but this has all come too late, and the good words from the Prime Minister today still leave many, many days to fix up this supply chain.
Andrew, let's talk about sport in a second, but first up, you've got concerns about the Redlands Hospital and its capacity to deal with a spike in coronavirus cases.
Look, I've actually been very supportive of Metro South and Queensland Health. I was there when they first started the testing. I've been very strong that GPs need to be pulling their weight. I don't think they should be just flicking everyone off to fever clinics. There's no better place to be looked after than your GP, and many general practices have adopted properly. They have the PPE, you're phoning ahead, they come out in the full protective gear and they can do a swab, if indicated, while the patient is in the vehicle without bringing patients that are sick into waiting rooms. There was some confusion with that newspaper headline. Those comments criticising the hospital were another MP further down, Peter, and I think it's been confused because I led that article. I'm very happy with Queensland Health and their response. They were caught out initially when GPs started sending patients up. That's not what GPs should be doing. GPs should be finding innovative, safe ways to deliver testing. And I want to point the second very important issue out clearly. Sullivan Nicolaides 3 hours ago released important data on their screening. They are only finding 1 corona case for every 500 tested. Now, this is a very important point. Around 1,000 cases of runny noses, there's probably only 1 corona case amongst them. But the treatment is the same. We need to self-isolate. Peter, the 2 points I'm making locally. First of all, we need to do way more as individuals. It's just un-Australian to be breaking this distance rule. It's un-Australian to be playing full contact sport. It's un-Australian to be in crowded places right now. And Australians just shouldn't be, of any age. Schools should not be allowing it in preps and year ones, kids hugging each other, but it's happening. Let's take to the next step. We need to be far more understanding that if you're not doing something that would catch a cold, it's okay to keep doing. We should still be able to go to the Chinese restaurant. We still should be able to go to the library. We should be able to go to window shopping because it's respecting the 1.5 distancing measures that are currently the guidelines. I beg Australians, don't stop doing what you'd normally do, because this is an economic tragedy. It's not a tragedy of a viral infection. And we've got to make sure that when we get through this, and I'm predicting 3 to 6 months, we're going to have to repair that economic hole that will appear in the budget. And there's 2 ways of doing it. There's the shovelling out of money with respect. It's not welfare. This is genuinely keeping businesses and individuals afloat. And that's going to happen. It's going to happen in the next few days. There will be looser eligibility rules. There will be waiving of both potentially assets tests and the wait periods, and it's going to apply to more people. I'm hoping it'll look after contractors, the sole traders we've all talked about, but staff as well. Staff will be looked after. Please don't panic. But ultimately we need to be even more innovative, because the federal government, they can't just stimulate every 2 weeks. This is going to be way longer than 2 weeks, and I suspect there'll be further innovative measures coming through Treasury that are more sustainable, because it's not just going to be fixed with cash splashes. It'll be more creative than that.
Andrew, should the AFL and the NRL be basically cessating their competitions right now?
It's a no-brainer. You can't play contact sport, Peter. You're breaking the distancing rules. It's ridiculous. They've been held up because they don't want to lose money. And I think it's appalling. I've made this clear 2 weeks ago. All my junior sporters stopped. They know how stupid it is. And to see major leagues not making the tough calls netball and cricket make is unbelievable. Look, secondly, it's okay to play sport if you maintain the social distancing. If you're a very good touch football player and no one can get within 1.5 metres of you, go for your life. If you're playing cricket, of course, you're sharing a cricket ball. That's obviously not something you can do. Badminton, tennis, please everyone, keep doing it. Buy a drink and buy lunch on the way home. Keep doing what we normally do. That's Australian. It isn't to panic, to freeze and to cause immeasurable economic damage. And as I've said, this is the challenge. It's maintaining safe economic activity. And the 2 points I keep repeating: be way more sensible with the distancing at an individual level. We need to be tougher. But at a community level, we need to keep doing what we're doing, looking out for people, setting up networks to look after the hundreds of people now in quarantine. They're going to have mental health issues, more so than just delivering groceries. Every community in Australia should be setting up these support groups for these unique times where we have to look after people in their homes. In some cases, the whole family. That's actually quite easy. Some people are living with others who aren't in quarantine. Extremely complex. And then lastly, people living on their own. They are extremely exposed, and we know a quarter of Australians do, and about 10% of those who travel overseas do. I mean, there's 1 million Australians overseas at any one time, Peter, so they're all going to be coming home. I know it'll be slightly less at the moment,
Sure.
but that's a huge test in every electorate and city in the country.
There he is, a fired-up Andrew Laming. He joins us, the member for Bowman, always makes plenty of sense on Sky News across Australia. Thanks for joining us, Andrew.
Pleasure.
Hundreds of Australians